For that warm introduction. Um, Good morning, everyone, and thanks for having us today. Um, today, we're going to talk about a case in Washington State, and I'll turn it over to Dave next.
Hi, my name is Dave Ward. I'm the Policy and Planning Manager with the Hazardous Waste Management Program. Our program, just so you have a little bit of background, our program is a coalition of governments in the Seattle area, serving King County, Washington, 39 cities and 2 tribes. We provide household and small business hazardous waste collection services. We have residential services and business services programs that provide direct service to our customers. We have a we have a research team that supports all that work and a policy team. And Monica and I are both part of that policy team. And today we're going to share with you some of our experiences learning about the role of aluminum cookware and lead exposure in Washington State.
Refugees entering the United States go through a medical screening that includes a test for elevated blood lead levels. In recent years, the Washington State Department of Health reported an incidence of elevated blood lead levels among refugee children from Afghanistan. Blood lead data for children under the age of 15 who are residents of King County are forwarded to public health and to the Hazardous Waste Management Program for investigation. During investigations in the homes of these Afghan children with elevated blood lead levels, the Hazardous Waste Management Program found the probable source of lead exposure to be cookware. The highest levels of lead were found in aluminum cookware imported from Afghanistan by local refugee families. Approximately 70% of lead poisoning cases referred to the HazWaste program were attributed to this source, a style of Afghan pressure cooker that had been brought from overseas. You might ask why aluminum cookware contains lead. In some countries across the world, cookware is fashioned from scrap metal, which can include soda cans, engines and radiators, airplane fuselages, batteries, computers, and electronics. These metal scraps are heated in a furnace, and molten aluminum comes out at the bottom. The metal is then flattened into sheets to stamp or spin cookware, or it is cast, where the metal is poured into sand molds. After the discovery of lead-contaminated cookware among Afghan children and their families, the HazWaste program forged a partnership with a local community-based organization, the Afghan Health Initiative, to further educate community members on the high levels of lead in Afghan pressure cookers, conducted home visits, and provided safer alternative stainless steel replacement cookware to hundreds of affected families. In our home investigations, staff used an XRF, or X-ray fluorescence device, to identify contaminated cookware. Imagine a sci-fi ray gun-looking device which can be used to detect certain metals in cookware in the field. Once we determined the cookware was a likely source of exposure, our research scientists went to the lab and began doing leachate tests to simulate cooking conditions and measure how much lead actually migrates or leaches out of cookware into food during cooking. This was a novel method developed in collaboration with the University of Washington and the Hazardous Waste Management Research Team to observe how lead migrates out of cookpots under simulated cooking and storage conditions. This effort involved testing hundreds of pieces of cookware for lead content. In several cases, they found extraordinarily high levels of lead migrating into food. During cooking, many of these items far exceeded the FDA's interim reference level for lead. The HazWaste program investigated further by shopping for aluminum cookware locally and through online major manufacturers like Amazon, Etsy, and Alibaba. The testing also revealed that lead was not only present in traditional Afghan pressure cookers, but also in the aluminum cookware purchased locally and online.
As our investigations dug deeper, we began to realize that we were just seeing the tip of the iceberg on this. And ultimately, we realized it wasn't just refugees that were at risk, but all Washington residents were at risk. So we reached out to the FDA and presented them with our findings based on our test results and our peer-reviewed publications, which are distributed as part of this workshop. The FDA eventually issued an import restriction on those Afghan pressure cookers and other specific pieces of cookware. One online vendor that specialized in marketing imported Afghan pressure cookers primarily to preppers for outdoor cooking, because you can fill those pressure cookers with food and just throw it on a bonfire. That vendor was shut down by the FDA. We also partnered with the Washington State Attorney General's office and then reached out to Amazon, Etsy, and Alibaba, requesting that they pull specific products down from their platforms. They all responded favorably, and Amazon even reached back out to us asking for advice on how to set lead screening levels for other products on their platform. So we felt like that was a positive move. However, I should point out that all of the platforms still have other cookware on their platforms that does contain lead. The research and the outreach, all of this built up and prompted the introduction of legislation in Washington State. Washington Bill HB 1551 limits the levels of lead in aluminum cookware statewide to 5 parts per million, and also provides for enforcement of that. The bill was introduced in 2023, received very strong bipartisan support, minimal pushback, and it passed the Washington State Legislature unanimously in 2024, just earlier this year, a couple of months ago. To our knowledge, this is the most restrictive such legislation in the country as it applies to lead limits in aluminum cookware. We did debate considerably internally on what was the best standard that we should be shooting for in that legislation, because there are several ways of measuring lead. We recognize that there is no safe level of lead exposure, so we wanted the allowable amount to be as low as possible. It also needs to be detectable by the enforcement agency. In this case, it was the Washington State Department of Ecology. And they would be the ultimate enforcement agency for the bill, so it had to be workable for them as well. In the end, we settled on 5 parts per million. It's low, it's achievable, and it's measurable using standard measurement methods. I should also point out that we were also successful in passing a related bill on cosmetics that banned a number of toxic substances from cosmetics, including lead, this year. So we consider this one a double win for us in Washington State. Moving forward, we are now testing cookware produced in India, specifically those made of Hindalium, a high lead alloy, which is still for sale. You can still go on Amazon's platform and you can find Hindalium pots for sale. We're also testing cast aluminum calderos from Colombia. When you hear caldero, think something akin to a Dutch oven almost. We've also found very high levels of lead in brass fittings, pressure relief valves, rivets, regardless of the country of origin. But also, I should note that we have found virtually no lead contamination in stainless steel and in cast iron cookware. So when people ask us, well, what's the alternative? We usually recommend stainless steel and cast iron. So we're happy to share our published research on this work, and Haley will share the links to those studies with all participants today. We want to thank you all for the opportunity to highlight this important legislation and share in our limited successes in Washington State.
Thank you so much, Dave and Monica, for that great example. I think again, the Washington State it highlights the intersection, the important work that all of you did, but the intersection to me that happened between the researchers, that you had and that you saw an issue, and then the local, state, federal government officials and agencies that had to come together, along with the nonprofit sector and the for-profit sector when you're talking about, Amazon, Etsy, Alibaba, et cetera. And then finally, just legislators working together, that it was really encouraging to hear the bipartisan support in the HB 1551, that came and looking to find a solution to this problem of the lead exposure in your community. So, and I think that just turns over from the great information that Drew had along with Dave and Monica, and looking at what kind of funding policy, things that can happen that's needed. And so one of the things here at First Focus, of course, that we do is analyze the federal budget and programs, and how much of that benefits children and young people. And unfortunately, children receive, of course, very little share of the budget, considering that children make up about 30 to 50% of the world's population. And in fact, in fiscal year 2023, our analysis showed that only 9.89% of the entire federal budget was invested in children here and abroad. And then as Drew pointed out, just how little money in comparison to some of the other things, goes into lead exposure and things, and, where we can use or is really needing more investment. I think I was pleased to see that the Biden-Harris administration has provided here in the United States $350 billion in the American Rescue Plan for schools and child care centers to replace lead piping. $90 million has been announced to be used to reduce lead-based paint in public housing. And then the bipartisan infrastructure law that was passed also provides billions for states, tribes, and local governments to begin to update their water systems. So I think all of that is wonderful. And then, as Drew stated, we do have commitments from USAID and the EPA on their MOU to work together on reducing lead exposure. But I know in our analysis of the budget, there's only been about $2 to $4 million in the foreign assistance budget that has been committed to actually reducing lead exposure. So it's just such a minuscule amount. So again, while we applaud the efforts regarding lead pipes and paint, our panelists, presenters today, and the Washington State example really illustrates the need that we need to examine other sources of lead exposure and finding ways to mitigate that. So with that, I would like to turn it over to the questions and answers that people may have. And let's see. I know one person, one of our asked, can you share the Washington State legislation reference as well when you send out the reporting and slides? We can definitely do that. And I think it's a great example. And I guess with that, and speaking about the Washington State legislation, asking all of you, do you feel the need? I know this is for Washington State, and you said it's, as to our knowledge, the only state that is banning lead in cookware, but how would that tie into potentially federal legislation or federal policies, do you feel?
I guess I can, go ahead, Drew.
Well, I'll give mine. I think we're probably going to have come at this from different angles. So I want to talk for a second about the symbiotic nature of domestic efforts like those that are happening in Washington and the relationship that has to international efforts like our NGO does. The type of surveillance work that King County and Seattle are doing, that New York is doing, that a couple of other jurisdictions are doing, where they not only test kids, but then they test products or sources of exposure and make that data available. It's actually incredibly important for the international work that we're doing, because we take that data, often which tells us about international products that are causing lead poisoning in the United States, and we use that as like a roadmap to design our international work. So if we're seeing a lot of Hindallium pots, which Monica and Dave mentioned, it's a product that comes out of India, a metal cookware, a kind of alloy. We have an office in India, and we take that, and then we go use that information to go solve this at the source of production. And that has two benefits. It benefits Indian children and families, but that also has it also comes back to benefit us in the United States through reduced imports of contaminated goods. A very quick example of this, New York City does a wonderful job of this as well. They identified that children of Georgian ancestry in New York City were very highly poisoned by lead, and that spices that were coming from Georgia to New York were a main culprit. Well, UNICEF, Pure Earth, and others, and the government of Georgia then mounted a huge response in Georgia and have essentially tackled that problem in its entirety. And what New York City's health department is now seeing is an enormous drop in lead poisoning cases among kids of Georgian ancestry that live in New York City. But, and here's the policy thing, there are very few US jurisdictions that do this. If, for example, more jurisdictions did this type of surveillance and made their data public, and a federal agency compiled that information so that we had a national picture, oh, it would be so beneficial, not only for tackling this issue in the United States, but for tackling it globally.
And I would add to that, Drew outlined quite well the multiple sources of lead exposure that people and children are experiencing every day through so many different sources. Adding cookware onto that, in addition to all the others, the reason why we were able to identify this novel source of lead exposure was because refugees are tested and screened almost universally upon entry into the United States, no matter what age they are, and also if they are pregnant and breastfeeding, etc. So because of the testing and the screening and the follow-up that took place, we identified these elevated blood lead levels and were able to get into the homes and find this cookware. So I am going to always support more testing that needs to be happening, not only in Washington State, and Washington State definitely needs more testing. And I think federally, we should be looking at legislation for more universal increased testing of children under the age of 18.
Monica, that leads actually into the question because it asks for Washington State, what is the state's childhood blood lead testing policies? Because like, as you stated, the only reason this was detected was because there's required testing for refugees coming in. But what is generally, for Washington State, the blood lead testing policies?
Well, we have testing of, as we stated, the children and families that are refugees, and also children on Medicare who are supposed to be screened between the ages of 0 and 3, I believe, at least 2 times, between 12 and 24 months. So other than that, it's kind of on a case-by-case basis, and we are looking to really push more on that. Our testing has gotten extremely low. We're one of the lowest testing states, and especially since the pandemic. So we're currently looking at a lot of models all over the place to see how we can increase our testing. And we're also looking to speak with people on the Hill here today to bring light to this research and this source that could be affecting so many other states. We want to inspire other states to look at cookware, to look at testing, and also the federal government, so that we can really hone in on this issue, because it comes from a global perspective, but it also it affects all over the United States, and people don't realize it. Sometimes they see it as just a global issue or issue that affects certain regions of the United States, but we're really we're seeing the effects all over the place.
Blood lead testing results is one of the most effective tools that we have available to us to identify where exposure is happening. And unfortunately, as Monica said, in Washington State, we are among the lowest in the nation for testing rates. And that's something we certainly are working to change. But the effect of that is that in many cases we are reduced to guesswork as to where exposure is happening, as opposed to being able to respond to actual exposure, target the sources like we were able to with cookware, and then fix those sources and eliminate those exposures. It's a huge problem from our perspective.
There was a question asking, what is the policy on follow-up for children who, after being tested, have a detectable blood lead level? And I guess another one I think Mark had asked is, how do you report these findings, or how, where is it that they're forced or reported?
You want to take that one, Monica?
Sure, yeah. The testing goes through our state Department of Health and also through our Hazardous Waste Management residential services team, which actually goes out into the homes of children with these elevated levels, testing products, testing, all kinds of things, and connecting with families to make sure that we can reduce these blood lead levels. And so it's kind of our Department of Health, physicians, and our residential services teams working together to follow up with these families and get these levels down.
Great. Thanks, Monica. I know, recently in the media, they were talking about, I think, and Drew was talking about like the spices and things, but I know in the media, there was the recent about the applesauce, the contaminated applesauce, which was determined by potentially the cinnamon, but how the cinnamon actually was processed. It wasn't even, I think, correct me if I'm wrong, that it wasn't actually the cinnamon, but it was as the cinnamon was being processed that there was lead had gotten contaminated into the cinnamon. And so I just think about, again, how important it is that this isn't a United States issue or even just a Washington State issue, but that it really crosses, that can be impactful or impact anywhere. I know we had a question too, I think, asking about how big the problem is with lead pipes, specifically in New York, and if there's particular communities that are impacted. So I didn't know if any of you could answer that question.
Our organization only works, except for advocacy and awareness issues, outside of the United States. But what I can say is that the New York City Department of Health and Mental Hygiene is a leader in this field. They do wonderful work. They make their data available to the public. They have great guidance and information materials on lead poisoning sources and rates in the city. New York State is also a leader in mandating blood lead level testing. So this information, while we're not experts in domestic, issues within individual states, New York just happens to have a lot of very good publicly accessible information. And
We're
Kathy,
definitely looking to.
sorry, go ahead, Mon.
Oh, no, I was just going to say we're looking to them as well at some of their models because they've been really increased their testing rates by significant numbers.
And Kathy, you brought up applesauce. I just want to touch on that because it's such a good example of the nexus between the international issues and the domestic. And here I'm going to take the opportunity to pitch for, I should specify actually, when I said we spend $15 million on lead, that's international funding. That's what's referred to as overseas development assistance. So domestically, the United States has quite a healthy budget to address, particularly pipes, but internationally, it's almost zero. But the applesauce is a wonderful example of how we cannot solve even our domestic challenges by working only within our borders. There were hundreds and hundreds of children poisoned by applesauce. Even if we mounted a huge effort to test products as they were being imported, we could never inspect our way out of the import challenge. It has to be solved at the source. This challenge started abroad. As you said, it was about the processing of cinnamon. It wasn't even the growers. It was the processing of it where lead was introduced. And to protect, even if our interest is only on American children, which I suggest it shouldn't be, but if it was, we still couldn't protect them by just working within our borders. You have to solve it at the source.
And there's a question regarding the Washington law tries to prevent the distribution, of course, of contaminated cookware in Washington state. But how can the U.S. help stop the production of contaminated cookware in the first place?
Well, for the most part, the cookware that we found that had the highest levels of contamination were imported cookware. Domestic cookware, we found much lower levels. Doesn't mean that it's not there, because as I mentioned, things like brass fittings, pressure relief valves, and rivets, and other components may have higher lead levels. But for the most part, it was not domestic production where we were seeing the problem. Doesn't mean that it couldn't happen. We didn't get any pushback from any of the domestic producers when we were moving the law. We do regard this as an import issue primarily. It doesn't mean that but the thing is, it doesn't mean that it can't happen. And so we have to work within the authority that we have within Washington state. We can't regulate what people are using or selling in other states, but we can regulate what people are importing and using and selling within Washington state. Our hope would certainly be that other states would look at not just the fact that we put limits on lead, but that in cookware, but the fact that we set the limits as low as we were able to get them, and our hope would be that other states would start to match that, because that continues to put pressure on manufacturers who may be the bad actors, who have contaminated products, and that has an effect internationally and nationally. It's not just limited to one state. If we have 25 states, for example, that are all petitioning Amazon and Etsy and Alibaba to ensure that their products are lead free, that says a lot. It becomes more of a grassroots movement. And the question came earlier: what's the effect of state legislation on federal legislation, and how are those two interconnected? If we can provide a demonstration that this actually works, and it's achievable, and it's measurable, and it's enforceable, then that provides a model for both other states and for federal legislation. The trick is, in federal legislation, is to make sure that we're not also accidentally or inadvertently preempting state laws that may be seeking safer levels. That's something that we have our eyes open and we're watching very, very carefully. So, for example, there's an act in Congress right now to increase safety of baby food, and that's something that we are very anxiously watching. Something that we wholeheartedly support, but also we want to make sure that we're not getting preempted in our own state.
And if I could pick up on that answer, as Dave mentioned, U.S. jurisdictions have limited influence on what manufacturers in other countries do. And so, for better or for worse, that intervention abroad sometimes falls on organizations like ours. And I just will share briefly what we're doing about that. We are aggressively moving forward on research programs abroad that go into educational institutions, test pots in, say, a school's kitchen where they're cooking food for students, test the food that goes into that pot and test the food that comes out of that pot to build the evidence that this is a problem, that these pots are poisoning children in X country, with the ultimate aim of then working with those national governments and international funders to ultimately alter the production process so that lead is never introduced into this cookware. But this is really an emerging issue. This aluminum pot issue is one that, we've been working on lead for 25 years. We weren't talking about this 4 years ago. So the data is kind of ballooning right now, but it's still an emerging issue. And we're still kind of building that case to work on it so that funders say, yeah, this is a big problem. The cost benefit of working on it is clearly very positive, so that national governments where these pots are being produced start taking it seriously. Because ultimately, you don't want to rely on NGOs to solve problems. We facilitate, advances, and then it's up to governments, municipal, provincial, and national governments to solve these. But right now, they need the evidence. They need the case to be made, and that's what we're working on.
Great, thanks. There was a question actually asking, is testing of children in other countries routine for blood testing?
No. No country actually has a robust testing program, the United States included. Different states have different policies on the level of testing, but outside of high-income countries, national surveys of lead in children's blood there's just a handful of countries that have begun that process. In fact, if you go back before 2018, I think the number of low and middle income countries that had done a national survey was 0. Mexico was an early champion. The Philippines, there's maybe 10 or 12 countries right now that have started this process of doing nationally representative blood lead level surveys, but still a tiny number, which means that most countries in the world are flying blind, don't have good data on their burden. They have to rely on estimates. And without really good blood lead level testing, not only do you not understand the prevalence and severity, but all of the steps, the preventative steps after that are much, much more challenging without the visibility, understanding the geographic distribution of lead poisoning. All of that allows you to do the follow-up testing of consumer goods and environmental media, and it really all hinges on good blood testing. So it's critical that low and middle income countries have the technical support and the funding to get this started.
Thanks, Drew. We have a final question was asking, how did Washington State, I know Dave and Monica, you were talking about what was an acceptable level. And so how did you come to the acceptable level of lead in the product, and then like what's considered elevated blood level, and how did you determine that?
I can speak to the elevated blood lead level, and I'll let Dave talk about the other part, but blood lead levels exceeding 5 micrograms per deciliter in youth and adults have to be reported to our Washington State Department of Health. So that's the level that we consider elevated. Above that level.
And the question of how do you translate that into policy is a tough one. As I said earlier, we spent a lot of time debating between our policy in our program, between our policy team and our research team, trying to figure out, okay, what would be the best way to do this? How do we set that level? In some of the first published papers that Haley will be distributing to you all, that describes in part that process. But there are multiple ways to test. We had originally landed on 10 parts per million as being kind of the happy place where we want to be. We ended up with 5, thinking in terms of building in a safety factor. To say we are not the only state that has a threshold for blood lead. Earlier this year, Minnesota passed a threshold for cookware that was part of their children's product safety act that I believe sets it at 90 parts per million. What's unique about what we've done is that our proposal of 5 was based on the actual leachate testing that actually was looking at how much lead is migrating out of the pot into food during normal cooking conditions. And so that's how we ended up with a number as low as we did. I can't credit our research team enough for their work in figuring this out and in determining a level that was actually measurable. When we first proposed it, there was questions as to whether or not it was even enforceable, because there was a question as to whether or not the enforcement agency would actually be able to measure at that level. And fortunately, they are able to measure at that level, so they can provide enforcement. And the law actually provides the enforcement agency with the ability to lower the level even further under certain conditions in the future, if it can measure it and if it sees a reason to do so.
Great, thanks, Dave. I know we're starting to wind down on time and things, and so I just wanted to, I know actually Administrator Powers, I think, had given some kind of to wrap up, but had given kind of some potential areas to look at, right, for policy and going forward. And so she had broke it down, and I thought it was, I think that all of you had touched on it in your presentations and in our questions today. So I was looking at one, doing regular blood and market testing of blood levels, and to be able to identify the exposures and trace the exposures back to the source. And I think you've talked about the importance of being able to report that and maybe having a national database, when that information comes forward. Two was looking at passing binding controls to phase out lead in specific products and industries. So when you're talking about cookware, spices, production, things like that. Three, supporting private sectors to transition to lead-free and other alternatives. And then four, being able to enforce and ensure the regulations are followed that we have. I know that there are, like I said, some things that are in Congress. I think Dave had referenced there's like a Baby Food Safety Act that's, that I know people are looking at. There's also like a Lead Safe Housing for Kids Act. I know that's on the federal level, that's also been proposed. So those are just, some of the things that we can look at. So I just wanted to be able to wrap it up. I want to thank Drew McCarter, Dave Ward, and Monica Ayers for sharing your expertise, experience, and recommendations today. I'd also like to thank Mark Engman from Pure Earth for the collaboration, and my colleague Haley Winters for our instrumental work in making this conversation happen. And thanks also to my colleagues Tim Smith and Jake Espinal for their assistance as well. But I would like to just close by saying that this past April, a number of our U.S. senators introduced a resolution calling on the United States to invest in ending toxic lead exposure. One of the co-sponsors, Senator Van Hollen, stated that lead exposure poses a grave risk to children whose health and development can irreversibly be compromised by its effects, and to the broader communities and economies across the globe, so that we must prioritize lead exposure prevention so that we can ensure a safer and healthier future for children all around the world. So again, I want to thank our panelists, thank our participants for joining us. And please keep the conversation going in the comments or on social media using the hashtags Children's Week 2024 and hashtag It's a Kids Issue. And you can also visit our website, firstfocus.org/Children's Week, where the recording of this conversation will be, and you'll find other resources and action steps on all of our Children's Week conversations. And so I'd say thank you for joining us today, and have a good afternoon, rest of your day.